Pt.1
Oyenge, Yumno Yeng, Kililo Comtela, Wibie, Yorokom, Kimino Mitch Bot Lutadere, Oyeng, Katibori, Chimbarja, Wetching a bit, Chawachien, Neo Chawa Rio Mutiano, Radio Rupiny Kekem. Wajuli, Yumno Yeng, Makatibori, Chimbarja, Wetching a bit, the Chaka Chawachien, Neo Chawa Rio Mutiano, Radio Rupiny Kekem.
Betitwal la Radio Rupiny otieno matin waticha wa chel kida keka ngwen ania pita la beja tieni studio watiki welwa endo pi lokwa pi chawa chel mabino eno belo kelemono pi en wamiro no ni jomakonyo wa chulu pi chawa nyopi yup makiti eni gioni ngoma wanwa logo kore kikore so studio kuni chamo amini kare ini gochim miu penyi kana tiki peny mamir peny. I'm just briefing my people, and now we can switch to frequency 2 which is English. Okay, so in the studio I'm honored to have Bonnita Nyamwire in the studio, and your research manager for Pollicy.
Yes, please.
I would like to find out more about Pollicy, okay, as you say hello.
Okay. Hello, listeners. As introduced, my name is Bonnita Nyamwire, and I work for Pollicy as a research manager. Pollicy is Pollicy. So it stands for Poll as in collect information, collect data through polling, through research, through needs assessments, through situation analysis, and then use that data to make policies. So that's where the name comes from, Pollicy.
Interesting.
So poll and then use the information to make policies. Pollicy is located in Kampala in Bugolobi, Plot 7, Kulubya Road. And we are a civic tech organization working at the intersection of data, design, and technology. Yeah.
You're very welcome to our studio.
Thank you.
Right. And in the studio, I'm also honored to have Mr. Faruk Musema. He's from Gulu Disability Union Organization. Is that correct?
Yes.
Okay. Very welcome to our studio.
Thank you.
And Musema, you're the project coordinator?
Yes.
In charge of training, capacity building.
Skills development.
Skills development.
Yes.
Thank you very much for coming. And how is Gudipo?
Gulu Disabled is fine. We are all great. We have students who are already studying at our center. We are getting different skills in market relevant areas that we think after their program they will start doing work and earning living that is needed in their life.
Thank you for coming. And the studio, honored to you also welcome Anna Grace Accord. Anna Grace Accord is a community development officer with Gulu District Local Government.
Yes.
And that's my district local government. I'm proud to have you in the studio.
Thank you. Yes.
Okay, you're very welcome. Yes. All right. This talk show is actually paid for, in a partnership with NODIPO, the National Union for Disability Persons.
Yes.
Okay. And with fundings from Digital Human Rights Lab and GIZ funding.
Yeah.
Okay. Thank you very much. Okay, so let me come back to you, Bonnita. What are we here to talk about today?
Yeah, so today we are here to talk about a study that we did that is funded by Digital Human Rights Lab and GIZ. So the study is about assessing how policies and strategies that have been put forward by government that concern ICTs and assistive devices for persons with disabilities, how they have affected use and access of ICTs and assistive devices by persons with disabilities. So we have this project that has been running since last year in June, and it is going on till this year in June, that is June 2021. So we collected data last year in August, from 4 districts in this actually region, that is Gulu, Noya, Padel, and Omoro. And today we came to Gulu to disseminate the findings of the research that we conducted, which we did among persons with disabilities from the 4 districts. And we worked with stakeholders today that included people from government, the local governments from the 4 districts, stakeholders from disabled persons organizations, those are DPOs, and then also some persons with disabilities, to see how we can create ways to implement the suggestions that came out from the study findings. So that is what we have been doing today, and we are here again to reiterate the same message on this radio talk show.
Okay, thank you very much. We are talking here about ICT and then assistive devices.
Yes, please.
Can we please illustrate what they are using examples? Yeah.
Okay, so ICTs, in terms of ICTs, those information, communication, and technology devices or equipment, which include a phone, a telephone, so a smartphone or a feature phone. So a feature phone is the simple basic phone. The smartphone, of course, is the sophisticated phone which has different features. And then we talk about the television. Among the ICTs, we also include the radio. And then when we go to, so those are some of the examples of the ICTs. And then there is also the computer, there's the laptop, and so on and so forth.
Right.
And then for devices, these are equipments or items that are there to assist a person to be able to do what they are not supposed to do. So in the event that they are available, they are around, they have them, they are able to do what they are supposed to do. So assistive devices in this case are for persons with disabilities, are those items like a wheelchair. It will enable someone to move to where they were supposed to go. Like a hearing aid, it will enable a person with a hearing impairment to be able to hear the conversation, to get involved and participate in any kind of work. The visually impaired, there are also assistive devices for them, like a Parkins brailler, which is a machine that they can use to type out information. But there are also settings on phones that they can use to get information as visually impaired persons. Yeah, and so on and so forth. So those are some of the examples. A white cane for a blind person, they can use a white cane to move. Yeah, there are different types of white cane. Yeah, and so on and so forth.
Excellent. For example, I can set my phone to actually speak to me. You know, if I want to type something, I mention the word and my phone can type it for me.
Yes.
If I want to check my watch or my time, you know, it speaks for me and it will tell me it's 7 o'clock or it's 8 o'clock. So let me just come to Mr. Musema to just paint a picture. How widely available or accessible are some of these devices among our persons with disability community in this region?
Okay, thank you for giving me this opportunity. We have seen 2 areas. We have the ICT assistive technologies and we have the assistive devices. So for District Union, we have been focusing on the assistive devices, which includes the wheelchairs, the crutches, the hearing aid is part of the assistive technology, but it is there locally. There is one of the organization in Gulu which is called White Taker. They have been giving to our people with disabilities. So when it comes to this area of assistive devices, GDPO has been working so hard to ensure that how beneficiaries they get access to those equipments. But the challenge that we have been facing is that this organization, DPO, it is like an umbrella organization.
DPO, what's DPO?
Disabled Persons Organization. So GDPO, it is an umbrella organization for persons with disabilities, and we cover a bigger area because it is the mother of the district union in Omoro, the district union in Noya, the district union in Amoru. So our areas of coverage is too high, and we have a number of people with disabilities who are in need of these assistive devices, and it has been a big challenge for us to reach them, but we are all trying all our best. Like this year we are going to give 80 assistive devices, 40 wheelchairs and 40 crutches to our people with disabilities. So we are all working hand in hand with partners who are there to support us to ensure that our people get access to these devices. But when it comes to assistive technology, it is really a green area, because we believe that our people with disabilities, when it comes to education, it is a big challenge, because out of this research also it shows that about 60% of people with disabilities they stopped in primary level. So it means these devices will not help them. It is not a need to them. So one of the areas that we want to ensure that our people with disabilities starts using these devices is that we have to ensure that they also get opportunity to study, to go to school, and from there now they will start learning that I can use a computer using the readers that are there on the computer. You can use the phones, those digital phones. So it will give them the opportunity to start using and utilizing these devices which are on the market, to help them ease their life and also make them coordinate with others in the community. Yes.
Okay, so Bonnita, back to you. Having listened to that contextual issue, what was your finding like?
So thank you, our host. Beautiful question. So our findings were beautiful and informative findings.
Right.
So we found out that just like Faruk has said, one of them is that education levels for persons with disability are low. The education level is low, and then also most of them are unemployed. And then also in terms of disabilities, we found that physical disability was more prevalent. Yeah, the prevalence for physical disability was higher than the other disabilities, which included hearing impairment, visual impairment. Then also we found that most of the persons with disabilities, they are not aware of the assistive devices that are available and who the service providers are. They do not know who the service providers are. They do not know where these devices are. They don't know even about the devices. We also further found out about ICTs, that what is mostly used is the phone. Yeah, the telephone is mostly used, and they use it to connect to internet and search for information, go to social media. They use it to connect to mobile money and do their savings from there. And the assistive device which is highly used was the hearing aid. Because one of them, the reasons being the government of Uganda distributed some hearing aids around, but also the organization that Faruk has just talked about, they also distributed some hearing aid. So it is high, but the percentage was low, 11%, but it is the one that is highly used. Yeah. We further found out that persons with disabilities are not aware of the policies and strategies that have been put in place by government to promote access and use of ICTs and assistive devices. They are not aware of those policies. And then further findings also showed that there are barriers to access and use of ICTs and assistive devices among persons with disabilities. And the barriers are mainly partial implementation of policies and strategies, which becomes a hindrance again to the to others. For instance, because of that, you find that the prices are then high of the assistive devices. They are so costly, they can't afford them, and we have seen that most of them are unemployed. Those who are employed are in formal employment, like casual laborer, like just small jobs, yeah. And then the other barrier to access was lack of awareness, yes, on the devices available and where they are available, who are the service providers, yeah. Yeah, so those were mainly the key findings. Yeah, poor policy implementation, and then the cost of the devices, and then lack of awareness on the devices themselves and who the service providers are.
Okay, so before you came here, you were at a meeting where you disseminated these research findings. Were you able to make them aware, you know, of the availability of some of these technologies, and where they can find them, how they can find them? Were you able to do that? Can you just walk us through some of them? Yeah.
Okay, thank you. So yes, that happened today at the dissemination workshop. So while we did this data collection for this research, we also came across some of the service providers. They are not located in Gulu, unfortunately. They are located in Kampala. So we came across two service providers. One of them is called IncPat and is located in Bukoto in Kampala. The other one is called Enabling Services Uganda Limited. And so we sought partnership with Enabling Services because they have a wider scope in assistive devices. They do a lot of work. So we were able to travel with a person from Enabling Services. Today, we were with them at the workshop. They had a session, a very beautiful session with participants, telling them who they are, what they do, and they also came along with some of the devices and showed them to the participants. They came with white cane, a Perkins braille, a Victor reader, braille paper, a slate and stylus, name it, several things. So we successfully did that. We also gave them brochures which showed the different devices they have that are available at their place in Kampala, and they are located on Essex Road in Chambogo in Kampala. Yeah,
it might be baby step, but it's a giant leap in the right direction.
Yes.
Let's go for a break, and when we come back, I want us to talk about the why. Why should we even care about what we are talking about here today? Because I think the Sustainable Development Goals has a goal to leave no one behind.
Yes.
And if people living with disabilities are being left behind, that should be bad.
Yeah.
Why should we care when we come back? Thank you very much for now. We are going to take a break, and when we get back, we will speak more about this very interesting topic, technology. We say technology is the future. We'll find out more. All right.
Oyeng yumil yeng kile lokom tela wibye yorokom kimino mech bot lutade oyeng katibori chimbar ja wechia bit chawachien niyo chawa rio mutiano I radio Rupiny keken.
Angeni beru kapenyowi dana leone ni Super 3 diero na yacht kwanchimi di star achel aboro abich star aderadek ash pijomati airtel ka MTN di star achel abichel abich star aderadek ash iye namba niya dek meloch chake ki not waya bungwen choni Rupiny namba meyero dari choni Rupiny ticket wel chente memer tukune chakali bachel wali piera beach ki mobile pin namba ni wari chak turo to kombedi wiponi ali bachel chel mikero choli super jackpot maberi chinchabit chaka chawa dek daka piera ngwen ibuke de TV1 TV West ki Aban TV omer mwano karapau ya boro metro Super 3 tiyo kungite lot kapenui gaming box Super 3 diero na yacht Kwanchimi, di star, achel, aboro, abich, star aderadek ash pijomati airtel ka MTN D star achel abichel abich star aderadek ash iye namba nia dek meloch chake ki not waya bungwen choni ruping namba meyero dari choni ruping ticket wel chente memer tukune chakali bachel wali piera beach ki mobile pin number ni wari chak turo to kombedi wiponi ali bachel achel mikero choli super jackpot maberi ching chabit chaka chawa dek daka piera ngwen ibuke de TV1 TV West ki Aban TV omer mwano karapau ya boro metro Super 3 hiyo kuntike lodge pa National Gaming Board
Why ain't you done anything about it?
Because it's Thirsty Thursday.
Yeah, whatever. It's also the girls' day.
Girls' Day.
Yeah, it's like boys' night out, but only this is girls' night out on a Thursday. The girls' day.
Ah, good one. Now, if you really want to have fun with the girls, there's only one thing that will make your night.
Super cold Tusker Light in a
bucket. You know it.
Yup.
Don't do that.
What?
Oh, no. Tusker Light. Absolutely nothing to prove.
Not for sale to persons under 18. Please drink responsibly.
Wanluo TV dong nen maleng I Kampala. Nen Wanluo TV I Chana Rio adera bungwen I Star Times. Pimini ngech kigalo wang ma ai kumalumi Uganda. Kileb min yang mabe leb luo. Nong Wanluo TV I Gulu I Chana Rio adera Rio. Wanluo TV ngech mati kigalo.
Ana yegin manyen madong be loyo. Anen pat do pore. Piyome kadoni duni mangich ke bilo. Ana yegini smooth. Nong met pa gini smooth I will mechilinga libario kimbinye beach idukan moke ken machokeri. Kong pomer ke chat bot ngan mamaka pe o pa wi bor. Mat kuni guake.
Be the man who cares for her. The man who knows that making your woman feel safe and happy is what counts.
The man who chooses new and improved lifeguard condoms.
Because he understands the importance of trust.
Be the man who cares for her with new improved lifeguard condoms. Strong, safe, studded. New lifeguard condoms. Now available in pharmacies, supermarkets and shops near you. At 2,000 shillings only. This message is brought to you by Murray Stops in partnership with Ministry of Health. For more information, call our toll-free helpline 0800 220 333.
Super 5 NADL tamkon kailo milionia Pauya Beach inge dakika ya parapa kakari milionia Pauya Beach tiema loya inge dakika ya parapa ninu duchu gilmo meritim donye Super Family kune D star achel aboro a beach star aderadek ash manpi Airtel onyo star achel abichel a beach star aderadek ash pijomati MTN chi ye namba nia beach meloch ni chake not waya bungwen ye namba memero chone roping chi ketwel chente memero tukune chakali bachel wali piera beach ka mobile pin kodi weri chak turo chichot wiuponi turmali bachela chel mikero minigum melano alib mia beach inge dakika parapa kidong ticket mobichwali I Super 5 game maberi chia dekicheng baraja ibuke de TV ki TV West peken gumman chak turo kombedi ki Super 5 omerbet ki mwa pau ya bor metoro turman kunwati ite loch pa National Gaming Board lukali Super 5 aye Bet City Uganda Limited.
Oyeng yumil yeng kele lokom tela wibie yorokom kimino ngech bot luteder oyeng katibori chimbar ja wechia bit chawachien niyo chawario milkiano I radio Rupiny kekem.
Okay, welcome back from the break. You're listening to Radio Rupiny. If you're listening to us in Lira, then you must be listening to us on 98.1. We have a frequency in Lira. And this is in your project area as well, which is very fundamental. But the rest of the region, you're listening to us on 95.7. Studio, I have Bonnita, Nyamwire, research manager, Pollicy. Very interesting, the concept of policy that you talked about. And with me is Anna Grace Akot, my dear CDO. And then we have my brother Faruk Musema from Gudipo. We're talking about access to technology to persons with disabilities. I am having a second thought. Before we talk about the why, I want to come back to Mr. Musema and just give us a perspective of the population of persons with disability in Gulu, for example. Maybe that will, drive us to think about why it is important that we don't leave such a big population behind.
Okay, thank you so much, moderator. the population of people with disabilities in Gulu, actually.
And when we talk about Gulu, I presume we are talking about Gulu and Gulu City.
Yes.
Okay.
Yes. Actually, we had a research that was done in 2018 by World Vision. So they wanted to get the number of people with disabilities in the region. So that survey that they had did not quantify everything, but we have over 200,000 people. Yeah.
Are you kidding me?
Yes.
200,000.
Because the reason why it is like that, because we have different forms of disability, and also they have brought other categories of disabilities, like the albino. They are also now part of persons with disability. But this result covers all the district in Acholi sub-region.
Okay.
Yeah, not only Gulu.
Okay.
So it is in a wider area. So one of the challenges I think GDPU and the rest of people with disabilities are facing in the region is that their needs, they have all different needs, because we have different disabilities, and it is really hard for you to sort somebody's need and leave the other person's need. So it has been a dilemma to us, because you find sometimes we focus on physical disability because we feel it is more easier to advocate for them. Because when they see that you've given wheelchair, everyone see that you're doing something good. But when it comes to the visual and the deaf, some of the support that we give them, you cannot quantify or see it, but mostly it is really hard for someone to know that you're giving support to everyone. So as the district union, we are really trying so hard to advocate for every category of disability.
Okay.
Yeah.
Interesting. And I have a researcher in the studio. Why should I even worry? Bonnita, give us a picture of what you found in the field. I remember earlier on you said the prevalence of disability in this region is very high. Why is that so?
Thank you, moderator. So the prevalence, yes, true, of disability is high in this region, and it is highly attributed to the insurgency that happened in this region for so many years. So it left people disabled. People were hit by landmines. There are so many of them. So we found that most of them, they acquired the disability later in life, and it was largely attributed to that. So different forms of disabilities came up, and then also because during that time there was distortion in service delivery. Most of the cases you find that children were not immunized the way the routine immunization should go on. So acquiring of also disabilities that came from that was also it is also attributed to that, as well as nutrition. Yeah, because some disabilities can come from malnutrition. Yeah, it is like so. Those three are what could be the reasons as to why the prevalence of disability is high in this region compared to other regions. All
right. So in your study, we will talk about sample size, the number of people you reached, because I mean, you could not reach everyone. Tell us about your sample size and why it matters that we should integrate this sample size in this policy that we're talking about. Okay. Yeah. So
our sample size was, excuse me, our sample size was 373 persons with disabilities. So because every study has a focus, every study has a sample it wants to study, and so when with the scope of our study, when we calculated our sample, we studied 373 participants, but all of them were disabled, but different categories of disability. So they included the visual impairment, the hearing impairment, and the physical impairment. Yeah.
Now address the question of why does it matter that we bring these people along?
why it matters that we need to focus on persons with disabilities, especially to do with ICTs and assistive technology. So just like you mentioned earlier, I think, about the SDGs stating that we should not leave anyone behind. So persons with disabilities are a significant category that we do not need to leave behind. They need to be in employment just like the others. They need to live independently. They need to be included in health service delivery. They need to be included in financial services to benefit from each and every service that the non-disabled persons are benefiting from. Yeah. So we felt that we need to also look at them, but they need to do this, some of them with assistive technologies. So assistive technology, assistive device will assist them to be included, not to be left behind. So if we focus on enabling them to access and to use assistive technology, we will not leave them behind. And that's what we are advocating for in this project.
Okay. Interesting. And therefore, government has a big stake, or a bigger stake for that matter. And I will now bring in Grace to just tell us the policy side of things. How are you moving ahead, to try and address some of the gaps that we are talking about here as government?
Thank you, moderator. As you address the policy side, you need also to take care about the kind of impairments. We have almost 5 categories of impairments. One, we have people with visual impairments, those are the blind.
Sight, yes.
2, we have people with physical disabilities. 3, we have people with intellectual disabilities. Then we have little persons and albinism and others coming on board. And now when you look at Disability Act 206 amended 2020, it protects the rights of persons with disabilities and gives equal opportunities to persons with disabilities. In this act, you find that issues of ICT, issues of accessibility, issues of employment, right to employment, issues of right to health, right to education are all embedded in the act. And when we are implementing activities, we are guided by this act. Uganda rectified to the UN Convention on Rights of Persons with Disabilities in 2008, and the concluding observation in 2016 that Uganda rectified to. The Ministry of Gender has come up with the National Comprehensive Action Plan on the Rights of Persons with Disabilities 2020-24. That was launched last year in September here in Gulu, for the district here in Gulu, to guide the implementation on issues about the rights of persons with disabilities. And in this National Comprehensive Action Plan on the Rights of Persons with Disabilities, it is trying to help us comply, be guided how to implement issues related to persons with disabilities so that they are not left out. I can take an example. Issues of accessibility. For example, if you have a building, you need to comply. It should be disability friendly. You need to have the ramps. You need to have the toilets that's user friendly. You need to also have sign language interpreters in all what is happening so that people with hearing impairments can access services. All the braille services, that is part of the assistive devices, among others. So you find that the government has put in place policies to cater for persons with disabilities so that they are in position to access services needed. The district has continuously been at the forefront to sensitize, create awareness within the community so that they get to know about this. However, not all have received. and we're trying much as possible to make sure that all of them get to know how they can comply to these policies. The policies are already there, but some other people are not aware of it because, others may not have known, because some people may have the buildings and you find that they have steps. But when you talk to them, you say, oh, we have got to know. I think we need to comply because we need not to leave persons with disabilities outside. Not only that, we have the programs that has come on board on issues on special grant. It's called special grant. It used to be one from the district. It used to be from the district, but currently we have special grants both from the district and from the ministry. The one from the ministry is a piloted project that came on board last year. Now, you find that persons with disabilities are also receiving this to empower them economically. You see, when you are empowered, they are in position to access the services and also be empowered to access ICT services.
Is it adequate? Is it adequate? How much? How many people can it reach at a time?
In a quarter, in a quarter, we give to 4 groups. So that is the district grant. But from the ministry, I am glad last financial year, Gulu got almost 9 groups got from the ministry, and all of them. The selling was around 5 million. You know, the ministry sends money direct to the groups.
To the groups.
And indeed, this program, it is community driven. It is the community that prioritizes for their projects, that they see that it is good to generate income their hand, persons with disabilities. So we have seen that this is somehow currently working, and we are also continuing to make sure that they continue to benefit from this, so that we also comply, we are guided, we comply to what is already put in the policies. The same thing, even other development partners and other entities should also comply, so that we empower persons with disabilities and protect their rights, so that they access equal opportunities that other people are getting.
Thank you, Grace.
Thank you.
Bonnita, while the Gulu district local government is leading the way, there might be gaps. What do you see on ground?
Thank you, moderator. So on ground, so as much as the district local government is leading the way, Gulu and also the other districts where we implemented, they are trying their best. However, there are still gaps in implementing the policies and the strategies. Not all of them have, not all the persons with disabilities, of course, have been reached. More are still in need. So there is need to reach all the corners, which I believe the district has in its plans. Yeah, all the districts that we studied, they have that in their plans. Still, just like Anne said, the policies, for instance, they say like the buildings should be disability friendly, so as to create environment for them to be inclusive. They should be able to access. Yeah, so some of those, they have been done, others have not yet complied, but which we hope that the districts will go on to enforce and see that those are complied.
Thank you. Mr. Musema, I would like you to just, in a minute, supplement on this. What are the gaps, the existing gaps on ground that we need to work on?
Yes, I think the existing gaps on the ground is about education. For us, what we have been seeing is that people with disabilities mostly it starts from the parents, because their attitude towards their participation or going to school, it is really negative. So they don't believe in the ability of their children to achieve when it comes to education. So that has been a very big gap, because education is key in everything. So what we as DPOs in Gulu and other districts, we have agreed to emphasize mostly when it comes to education, because education is key, so that we can achieve everything we need when it comes to inclusion, digital inclusion and other aspects.
Okay, thank you very much. Again, we're going to take a break. When we come back from the break, I would like to open up my phone line so that we can listen, we can hear from you, and then also maybe you could ask all the questions that you want to ask before we talk about recommendations and way forward. This is Radio Rupiny.
Hey, John, how have you attained great success?
Oh, the secret is in my children. I purposed not to have so many children, and I invested my little savings.
I thought many children are a symbol of wealth. After their education, they will care for my old age.
But can't you see that you cannot educate all your 8 children now? How will you save or even ensure their education? Family planning is future planning.
Ah, you're right. I wish I knew that before. Planning how many children to have and when to have them is the Uganda we want.
This message is brought to you by the National Population Council.
Manali a jebelo ki yom chui ku ngoma aki ngomwa jeme mai puru yo bukiji arioni a jeta woni o atiki jema bejo mapol matika aki borwa kare dun po bati nyimi ingiti matai iwu yumer mam mirada maro timme bana na yo we hawa be panyo sili ali bariyo ki miapi mamega ki come kawilo ko igol umyo be kumeno ti yo mama por loyo me pollo ngoma okelo mapatki pero me tunyo be ngoma di come ti yo mama por loyo me pollo ngoma okelo mapatki pero me tunyo be ngoma yum chuni kuni baroko igol laga igol dak ki igol extra we me chilling ali bariyo ki miapi chicken wa queer me pangomwa
Meat potato there. A shell gas cylinder mamegi. Pinoki tamper-proof seal matiki code iguiye. Makei scanning. Bitualati a shell gas website. Kamaman biko nyimoko tiki shell gas cylinder. Pikare duju nene scanning shell gas tamper-proof code inginongo cylinder manyan. Man konyo wek peke kweli. Wiyuponi kapeke tamper-proof. No pe shell gas. Bid mai guake dori bille bon luoro. Ye shell gas. Shell gas, guaro in kilo pajuni.
Pilsner Lager, the red top lager. Cold, filtered for crispier taste. It's still got what you want. Pilsner Lager, the king's beer. Pilsner Lager. Hear the lion roar.
Alcohol is not for sale to persons under the age of 18. Please drink responsibly.
Meeting up with friends after work just got even better, more memorable, more distinctive, and even more refreshing. Get together and discover new Guinness Smooth, a distinctive new stout, perfectly balanced for a smooth, refreshing taste. Try new Guinness Smooth at the recommended retail price of 2,500 shillings. Guinness, made of more. Excessive consumption of alcohol is harmful to your health. Strictly not for sale to persons under the age of 18 years.
Wate simu ki Airtel. Manyuti iromo bedo ki smartphone. Meromo chulo jui ki jui. Chabit ki chabit. Unyo due ki due. Mai chulo nuchu. Chimmagaye. Samsung A3 core A01 unyo A11 D star ria bora ngwen star angwen ash piroto ke tuero gamuchiman lim Airtel Service Center moke ken machokeri where will smartphone mantin kama bene no MBs near B idwe chill mane chulo kilon mamegi kwate simu kibot Airtel the smartphone network.
Imagine 10 million shillings right here right now. Boss, 10 million but after well, what are you waiting for? Super 3 is giving you a chance to win 10 million shillings in the next 10 minutes. Simply dial *185 *33 hash. Enter your 3 lucky numbers followed by grouping. For example, 1, 2, 3 grouping. Enter amount from 1K to 50K and get that super feeling today. Banang, it's a dollar. It's real. Super 3.
18 years and above, regulated by the National Gaming Board and powered by Bet City Uganda Limited.
Itika penye iketmo mi odoreket kwere yewi. Pedo ichanem. Pien darling Uganda kile ye kuba mabejo from Gilamal wele yot. Dokri tutwal. Darling Uganda kele weaves. Braids ki crochets. Nong ye with darling mabejo tutwale. Kidukan maticho kwere loyom. Pinget mo kenekom darling Uganda. Limway Facebook mati darling Uganda. Instagram ti @darling Uganda. Twitter ti @darling Darling UG, on your WhatsApp number Gimatejero, Abira Boro, Abora Bongwen, Adera Bichel, Achel Aboro. Darling Uganda, we care how you look.
You telebi me bilone le bon kormo keken. Man po berbia keken. Ento bia piwa, ma taska light. O gari wile me chilinga libadek. Ika chat mo keken. Taska light. Light the way. Kon po mergi chat. Bod ngata mwahane pe o apawi ya boro. Matkon iyo mupore.
I'm thirsty.
Why ain't you done anything about it?
Because it's Thirsty Thursday.
Yeah, whatever. It's also the Girls' Day.
Girls' Day?
Yeah, it's like boys' night out, but only this is girls' night out on a Thursday. The Girls' Day.
Ah, good one. Now, if you really want to have fun with the girls, there's only one thing that will make your night. Super cold Tusker Light in a bucket. You know it.
Yup.
Don't do that.
What?
Oh, no. Tusker Light. Absolutely nothing to prove.
Not for sale to persons under 18. Please drink responsibly.
Oyeng, yumil yeng, kele lokom tela, wibye, yorokom, kimino ngech bot luteder. Oyeng, kategori chenbar ja wechia bit, chawa chien, niyo chawa rio milkiano, irate Rupiny keken.
All right, let me once again recognize our partner in this dialogue, and that is Pollicy. Pollicy, using data to, inform policies. Very interesting concept. And with me, I have Bonnita Nyamwire, the research manager. This talk show is actually courtesy of Pollicy with Nudipu, with kind contributions or donations or funding from, I forget that again, from Digital Human Rights Lab.
Yeah.
Under GIZ. Okay, in the studio, we also, we've been blessed to have Anna Grace Accord from the Gulu district local government. She's the community development officer. And from Gulu Disabled Persons Union, we have Mr. Musema Faruk. He's a project coordinator in charge of skilling. Yes. You said right now you're skilling some participants. How many are they?
We are skilling 53.
53.
Yes. 28 male, a female, then 20 male.
Are you preparing them, to be tech compliant?
Yes, actually, we have one of the courses which it is more of decoration and design. So it is more of tech because I want them to do graphic arts. So those who are well versed with computer will be doing that. Okay. So we have currently in that course we have 8 people doing that. So it is still a pilot. So if they do best, so it will help attract more people to go for those courses.
Okay.
Yeah.
So like you've just heard from Musema, we are talking about the need to actually include persons with disability in the tech department or in the tech world. ICT is the in thing right now. During the break we were saying even medicine is going online. Everything is going online. In this era of this COVID pandemic, people are shopping online. I just sit in the comfort of my home and then say, hey, I need that shoe. And then I place an order, and before I know it has come. So we don't want to leave anyone behind. Let's talk about recommendations as we also open up our phone lines. For you who is listening to us out there, if you want to contribute to the discussion, please give us a call on 0393 295 703. I'll let that say again, 0393 295 703. And my other second line is also now open, and that is on 312 336 957. Bonnita, let's talk about some of the recommendations in the study that you conducted last year in June, as we wait for callers. Yes.
Okay. Thank you, moderator. So the recommendations they focus on, of course, addressing the barriers that were highlighted in the research. And one of the recommendations is looking at cost.
costs.
Yeah, because cost was not only cost of the devices and the ICTs, but there is also cost of other additional services that are needed to be able to use the device. For instance, cost of internet. You have to pay for internet to buy data bundles, but also you have to pay for OTT. Yeah.
And that's limiting.
Yes, exactly. Given that we saw that most of them are unemployed. Okay. And then the other cost was of maintaining the devices. Some devices need to be repaired. Some devices need to be serviced after a certain specific time. And so there is that cost. Then also cost of being trained on how to use the device. Yeah. So if someone gets a software that is within the assistive technology, they have installed it on their laptop, they need to be trained on how to use them. If someone has bought a braille machine, they need to be trained on how to use braille. Yeah, and so on and so forth. So the cost involves all those aspects. So one of the key the recommendations was that as much as the government says there are no taxes that should be levied on assistive devices, and which is currently being implemented, but also the prices should be looked into. Maybe the prices need to be revised somehow. They need to come up with modalities of how those prices can be revised for assistive devices, especially because they are expensive, just like I already highlighted. But also the request was that government can come in and do some donations. They are doing donations, but they should increase on the donations, maybe to individuals, to institutions where these learners, disabled learners, go to school, and so on and so forth. So that is with cost. And then also they looked at, the other recommendation looks at creating awareness about the available devices and the service providers. So people need to be told in terms of awareness creation, these are the service providers that are available, this is where they are located, this is what they have, these are the devices that are available. And then also advocacy in terms of using the existing structures, using the DPOs like Gulu Disability Union and others like Nowodu, to create advocacy to promote access and use of ICTs and assistive technology among the whole population. Advocacy should not only go for persons with disabilities, because they live with others who are not disabled, they have guides, they have caretakers, so advocacy takes all of us.
Okay, interesting. Unfortunately, we are now out of time to continue the discussion in the studio. Maybe we'll go on with it another time. Mr. Musema, I will just invite you to say your parting shots as we conclude.
Yes, I want to take this opportunity to thank Pollicy for coming out with this research, because they have really opened our eyes. We didn't know anything about digital inclusion. So the finding that we have disseminated today has really opened our eyes, and we are going to use the data they shared with us to ensure that we advocate for our people with disabilities in Gulu and the neighboring districts.
Thank you very much. This admission is actually fundamental, that they were not aware. So as Gulu District Local Government moving forward, what are you going to do to create awareness?
Thank you. As part of our program, we already in the pipeline to advocate, sensitize, create awareness in all forums to make sure everyone get to know about these policies, existing policies. And hopefully in times to come, I know all the DPOs and other stakeholders will get on board.
Thank you for coming. Bonnita, you will have the last word for now.
Okay. I would like to thank the moderator and the Rupiny FM for hosting us here to talk about this important study, important findings. I would like to thank Gulu Disability Union, Musema Faruk, for also coming along with me, and Anna for representing the local government to share our sentiments about access and use of ICTs and assistive devices. And I would like again to thank Digital Human Rights Lab and GIZ for funding this project. Without them, we would not be able to go this far. So we thank them, and we are still going to be back in Gulu in the next months of maybe late March, and then April and May and June to do more awareness creation and more trainings in the digital aspect with persons with disabilities. So hopefully we'll be back in the studio to talk more about these issues. Thank you very much.
Thank you very much for coming. It's unfortunate, I just realized now that we don't have our phone network on. Otherwise we would have listened to you, who has been listening to us from the very beginning up until now. But I'm grateful to Pollicy, Nudipo, and Digital Human Rights Lab for paying for this airtime. Thank you again. I will invite you another time to come back.
Okay.
Thank you. All right. Laun radio pi kumbedwa gikkan ingewan kawa no news tika donya kan abogalam kacharomo udvud mabe. Mr. Musema, thank you for coming.
Thank you.
Have a good night.
Okay, you too.
Anna, good night.
Good night.
And Bonnita, good night to you. Good night. Bye.
Lok paluba. Kwena mamini gen neno duchu i radio roping.